Hi friends, for those of you who are new here, my name is Lisa. I'm a registered nurse and I do a lot of videos that are about medical mistakes, how can we improve on communication, how you can be your best advocate to have a more favorable outcome and improve trust with your healthcare provider. I also do vlogs and I do a lot of conversations with you about dementia, being a caregiver, and many other fun things. What are some ways that poor communication can be prevented in a hospital, a clinic, a medical setting, before you're going to go in for surgery? And what are some of the devastating things that can happen when poor communication between patient and healthcare worker occurs? Wrong surgeries, wrong procedure, medication mistakes, allergies that the medical team didn't know about. The truth is that even the best doctors and nurses are human. Errors are going to happen. That's why one of the best things and most powerful things you can do is learn to be your best and most efficient advocate. I'm going to give you some examples of what would work, what does work, and some examples of things that I've seen that have made errors occur based on the miscommunication between the patient and the provider. Now, I know everybody always wants to blame the provider, the surgeon, the nurse. It's just how it works. We hear about that kind of thing all the time. I'm going to tell you about a very popular YouTube channel called The Patient Story. I love it, and I listen to patient stories over and over, all different ones. I will link it below. There are other stories, medical story channels and things like that too, but what it does is it helps us all to learn and understand about these brave men and women and children who've gone through medical experiences. What has happened? What is their story from start to middle to end and on of how they're being cared for, how their diagnosis evolved, and they also talk a lot about what they would have done differently. So let me share some ways that you can be your best advocate, and then I will interject some things that I have seen, listened to, watched, and learned about through the years as a nurse on how you can not be your best advocate. What would get in the way of the most favorable outcome? So let's talk about it. The first thing is when you're going to the doctor, when you're going to speak to a surgeon, if you have a new medical diagnosis, if you are unsure about the treatment plan, the best thing you can do is bring somebody with you. A second set of eyes and ears, somebody that can take notes, somebody that can bounce off some questions that you might not be thinking about. Bring somebody with you. So often people say no thank you to that out of embarrassment, I don't know, out of feeling that they don't want to burden somebody, or they feel like I should know it, so I'm sure it'll be fine. There are many reasons, but the best thing to do is bring somebody along with you, a family member, your adult son, daughter, your friend. Tip number 2, what else could this be? Talk to your doctor, ask questions. These questions are not stupid. Your questions are welcome. You should be asking questions. You want to ask questions. Start your list before you go in. Here's the question, what else could this be? Is this really necessary? A really important question I think that people should ask is, if I don't do that surgery, if I don't take that medication, if I don't follow through with this procedure, if I choose to not have chemotherapy, or if I want to take an alternative approach with my chemotherapy, can I do that? Ask those questions. Often people walk away and they say, the doctor never told me X. But remember, you also didn't maybe ask X. They cannot read your mind. Please speak up and ask, what else could this be? What else could I take? I'm not comfortable taking that medication. Is there another one I could take? Please ask those questions. Speaking up can be really difficult for people. Speaking up and asking questions can make people feel as though I don't want to question this doctor. Sometimes people can't even question their person cutting their hair, or they keep going back to somebody who doesn't do a good job. for them or for their home or construction or anything because they are afraid of hurting people's feelings. That is admirable. However, not speaking up can also be life-threatening for you. Here's another tip. Know your medications. That includes vitamins, minerals, herbs, and other alternative medications that you're too embarrassed to say that you're taking. You need to speak up because what if there's an interaction that might occur with one of those vitamins or with, a lot of people want to take ivermectin these days, but what if you want to take ivermectin, but if you don't speak up and say you're taking it, then it will interfere with something else that you don't know about. So if you're going in for surgery, you're talking to anesthesia, or you're talking to your doctor or provider who's going to prescribe a medication for you, be sure that you know your medications. It's not good enough that you just know the colors of them. We hear this all the time in healthcare. It's that pink oval pill. It's that beigey colored square one. It's the one that I've been taking for years. Don't you see it on my chart? Healthcare providers see hundreds and hundreds of people, thousands of people as time goes on. And sometimes people don't come back to the doctor for several years, or a year has gone by. You can't expect the provider to remember every single medication or take the time to look it up. Help them along by explaining what medications you're on, what kind of things that you're trying out, and see if that is something that they would like you to continue taking or if they want you to hold on it. Another tip is use the power of teach back. When the provider has or nurse has talked to you about, say, discharge plans, for example, or post-surgery things to look out for, post-surgery education, whatever it might be. When I talk about teach back, I'm talking about you repeating back in your words what you think the provider, nurse, respiratory therapist, PT has explained to you. It is really important that you understand it. And if you don't speak up and demonstrate it back to them, then they assume that you've got it. Don't be too embarrassed to speak up and say, can you explain it to me again? Can you show me that again? I want to make sure that I do it right. Here's another really important tip. Please follow up with whatever instructions you have been given. So if the doctor wants to see you in 2 weeks, it's not just to get more money out of you. So that's something we see all the time. Here's another little side thing I used to see and hear about. So if somebody has multiples and they're giving birth and one comes out vaginally and the other needs to go back for, mom needs a C-section for that second one, we hear people saying you're doing that just for money. You're doing that to bill the insurance company because it's going to give you more money to do a C-section. Or you're using this prosthetic instead of that one because you're going to get more money for that. That's not the case. I can't speak for everything all the time, but that's not what they're thinking is, I think I'm going to quickly switch this medication to that one because that's going to give me more money somehow, or going to give the hospital more money. Remember, doctors don't run the show. Insurance companies run the show. I mentioned this a little bit earlier, but please take notes before. A checklist is really a good way to make sure that you're accountable for your questions that need to be and your conversations that need to be communicated. And it's also a good way for your provider to also give you questions back. So give you your answers back. Check it off. I really need to know, can I mix this with this? Or I want to make sure you know that I'm really terribly allergic to turmeric. Is there anything that I need to worry about with interactions with that? Whatever it is, a checklist is critical. It's used in the operating room. It's used, I think, with pilots, with teachers, with everybody. It's a really good way for a check and balance for everybody. I'm going to close with what I feel is the most important thing about being your best advocate when you are speaking with a healthcare provider. People like to self-diagnose. There, I said it. People want to say, my rectal bleeding is because I'm sure I have hemorrhoids. I had them before. So they've missed an opportunity to talk about that with their provider because they already are perfectly satisfied that they know why they have blood in their stool. That cough that they've had for a really long time. Here comes the self-diagnosis of, well, I have asthma, so I really don't need to worry about it because I already know what it is. If you watch the patient's story, you're going to see story after story of a theme that is repeated often, which is self-diagnosis, putting it off, thinking that you already know the answer. And then, as we all know, a delay in care is never a positive, most favorable outcome. Prompt care is going to be the most favorable outcome for patients. But if you are steadfast in thinking that you know the answer, you're going to delay care. You don't always know best. My husband's best friend self-diagnosed his rectal bleeding with hemorrhoids, and he had stage 3 colon cancer. He tried to get treatment as fast as he could just to put his financial and other type of business affairs in order. It quickly spread to stage 4, but he was sure that it was just hemorrhoids again. So don't self-diagnose. It's better to go in and be sure. I hope this was helpful. Please consider subscribing if you like health-related topics, things that are oopsies, medical stories, and even some fun vlogs. Thanks for listening.